Good morning, students. In this video, you are going to learn about therapeutic communication techniques. The objectives are students will be able to define therapeutic communication, enumerate the therapeutic communication techniques, explain in detail about the therapeutic communication techniques, and list the nurse's role in establishing therapeutic communication. At the core of nursing is the therapeutic nurse-client relationship. Nurses establish and maintain this relationship by using nursing knowledge and skills as well as applying caring attitude and behavior. Therapeutic communication works as a treatment for persons, help to develop therapeutic interpersonal relationship, decrease anxiety, enhance patient compliance, and result in an optimistic experience for all involved. Nurses use therapeutic communication techniques to provide education and support to patients while maintaining objectivity and professional distance. The definition of therapeutic communication, it is defined as the face-to-face process of interacting that focus on advancing the physical and emotional well-being of a patient. Another one, therapeutic communication is a meaningful, ongoing communication with the client in an atmosphere of mutual respect and trust, whereby close helping relationship will be established, which allows the nurse and the client to work collaboratively, given by Vanda Moore in 2006. There are various techniques used to enhance therapeutic communication, such as listening, broad opening, restating, clarification, reflection, humor, informing, focusing, sharing perception, theme identification, silence, and suggesting. Therapeutic communication technique is a key to communication. Listening. Listening is an active process of receiving information. Listening is not only hearing, it is putting into action the active listening. Real listening is active listening and not passive. Here you can see two nurses' conversation. One is saying to the colleague, one reason why my patients like me is because I listen to them. Listening is your whole body listening. So brain is thinking, at the same time eyes watching and ears listening. And why must you have listening as a technique? To elicit complete information of a patient, to avoid assumption, and to get important cues from the patient. And how is it done? By using receptive non-verbal communication such as eye-to-eye contact with the patient, nodding your head when and where necessary, and using gestures, appropriate gestures, and using smile. And what is the therapeutic value behind it? Expressing nurses' interest and acceptance of the patient to bring positive outcome. Broad opening is the next technique. Start the conversation. So it is encouraging the patient to select topics for discussion. Broad opening is used as a technique because not to miss any information from the patient. And how is it practiced? So before using broad opening as a technique, the nurse has to assess the emotional stability of the patient to ascertain if the patient is in a mood to even speak, because it's going to be just a topic given or something given for the patient to open up. So pick up the words from what they say. Usually it is like, you can ask the patient, what are you thinking about? So once you ask this as a broad opening question, you can expect anything from the patient's thought process. So he starts speaking about it. So what is the therapeutic value behind? It increases the self-worth of the patient. Restating is another technique. Restating is repeating, reiterate, retell, reword, rephrase, paraphrase the main thought expressed by the patient. Why restating is used? For confirmation that the nurse understands right about patient's expression. How is it practiced? So when the nurse is speaking to your patient, so the main thought she wants to just, uh, restate it. So what she does it, she picks up the word from what the patient is saying and she rearranges and she puts it forward. Say for example, she might say to the patient, you say that your mother left you when you were 5 years old. So the main thought which the nurse wanted to restate was the mother left the patient, that too when she was very young. So what is the therapeutic value behind it is validation of information. Clarification as a therapeutic communication technique. Clarification is attempting to put vague ideas or unclear thoughts of the patient into words to enhance the nurse's understanding or asking the patient to explain what he means. Why clarification is used as a technique? To correlate the behavior to action. And how is it practiced? By asking the patient during the conversation, could you explain it again? I'm not sure if you're saying that. What made you think so? So these questions, this clarification could be based on patient's feelings, ideas, perceptions, so that it eliminates the ambiguity, confusion, misunderstanding, and it brings about understanding, and there is clarity. And the therapeutic value, so having clarified, the nurse, she can plan the right nursing intervention with the patient. Reflection is directing back the patient's ideas, feelings, questions and content. Reflection techniques, why it is practiced? To make the patient feel that he or she is not alone. How is it practiced? Putting oneself in other person's shoes. The nurse put herself in the patient's shoes. And say for example, a conversation goes like this. The nurse says, you are feeling tense and anxious and it is related to a conversation you had with your husband last night. So here the nurse says, I understand how you feel. So the therapeutic value here, mental health practice, it signifies empathy, interest and respect for the patient. Humor is one of the therapeutic communication technique where there is discharge of energy through comic enjoyment of the imperfect. Humor as a therapeutic technique, why it is used? To downsize one's feeling, emotions and problems. How it is practiced? Making oneself, the nurse, look imperfect. For example, the nurse, when she wants to administer medication, she finds the patient in the mental hospital is angry, it doesn't want to take the medicine. She says to him, do you know, I used to do, when my mother gives medicine, I used to throw the medication out of my window when I was a small child, and she used to giggle and she used to say that I used to make my mom run about, and then somehow she will catch hold of me and she will see that I take the medicine. She would say in such a way that you will laugh and his mood changes. So what is the therapeutic value behind it is reduces aggression and anger. So this is one of the therapeutic technique where healing takes place, and then she convince the patient because his mood is come down, his emotion has come down, so it is easy to help him understand and give him the whatever the nursing action. So here I told you an example of giving medicine. Informing is the skill of information giving. Why informing is used as a technique? To regulate consent regulation, to train and adopt certain things. How it is practiced requires usage of knowledge and skill. What is the therapeutic value behind it? It's promote patients' well-being and self-care, promote awareness. Focusing is the questions or statements that help the patient expand on a topic of importance. Focusing is used for getting into specifics. How it is practiced, funneling down to problems through open and closed proofs. For example, the nurse asked the patient, I think that we should talk more about your relationship with your father. What is the therapeutic value in this? Identifies core issues or the central issues and problems and keeps the communication process goal directed. Sharing perception is asking the patient to verify the nurse's understanding of what the patient is thinking or feeling. Why sharing perception is used? For identifying contradicting behaviors. How it is practiced? The nurse observes, directing, asking politely to the patient. And here you can see a woman here, she's smiling. On the outside, the nurse observes and she asks politely to the person, you are smiling on the outside, but inside you are angry, miserable and angry on the inside due to grieving a child's suicide. So what is the therapeutic value in mental health here? It removes confusion and avoids medical error. Theme identification. This involves identification of underlying issues or problems experienced by the patient that emerge repeatedly during the course of the nurse-patient relationship. Theme identification is why it is practiced as therapeutic communication technique for getting deeper and self-awareness, and how it is practiced, identifying triggers, pain points. Example, the nurse asked the patient, I noticed that you said you have been hurt or rejected by the man. Do you think this is an underlying issue? Therapeutic value to correlate experiences, and the patient is helped to explore his feelings and behaviors. Silence is lack of verbal communication for a therapeutic reason. Why silence is used? To gain confidence, build trust relationship, and to offer tender loving care. How it is practiced? By the presence of the patient or by giving therapeutic touch and non-verbal communication. For example, sitting with a patient and non-verbally communicating interest and involvement with the patient. What is the therapeutic value? It conveys support, understanding, and acceptance. Suggesting. What is suggesting? Is a presentation of alternative ideas for the patient's consideration relative to problem solving. Why suggestion is used? To provide options and alternatives. How it is practiced? Relating problems to solutions. So, for example, have you thought about responding to your boss in a different way when he raises that issue with you? Therapeutic value allows patients to explore values in the unique life situation. Nurses' role in establishing therapeutic communication. Consider patient as a primary focus of communication. Maintain professional attitudes such as rapport, empathy, respect, trust, genuineness throughout nurse-patient interactions. Observe and interpret observations. Use open-ended questions. Assess the patient's intellectual competence to determine the levels of understanding. Ascertain if communication is taking place between the nurse and the patient. Recognize when to speak and when to be silent, developing a sense of timing. To wait to proceed at the patient's pace and speed. The take-home message: therapeutic communication is an important skill to practice in patient-nurse interaction. Using combination of techniques can help achieve the goals in mental health practice. It promotes patient-centered holistic care. Practice is the key to acquiring therapeutic communication